As we look back at the policies put in place because of the pandemic, the effects they've had, and thus moving forward, we're staying on that topic, but switching the focus just a bit as we look at the impacts lockdowns have had and this pandemic has had in general on our long-term care facilities. The American Healthcare Association, which represents more than 14,000 nursing homes and long-term care facilities nationwide, put out legislation with these reforms on the systemic issues facing those who live and work in these facilities. In it, leaders say the pandemic exposed and exacerbated issues that have got to be addressed at the national level. Patti Cullen is the president and CEO of Care Providers Minnesota. We have spoken to Patti numerous times throughout this past year, and there are so many issues important for our seniors, Patti, that we have touched on. This, though, is incredibly important on the national level. So let's start with some of the specifics that are in this proposal. I'll let you explain.
Sure. As we took a look at some of the not only the chronic issues impacting our profession, but how they were elevated to almost to crisis levels during the pandemic. And they were things like clinical. Infection control was so important. And what do we do with infection control? Workforce. We knew that as we had a shortage of workforce that was further exacerbated when they had to leave because they were COVID positive, that we didn't have a bench that was deep enough to fill those spots. So it was a crisis when it came to workforce. We also took a look at things of how do facilities respond, and they didn't all respond equally. And if they didn't come out of the COVID crisis really focusing on quality improvement, we needed to do better oversight of some of what we're calling poorer performing facilities. And finally, we looked at the area of what does the building look like? We don't have private rooms. And so when you don't have private rooms in nursing facilities for every resident who lives there, when your roommate has COVID, you will have COVID. So we need to get ready and prepare because there will be another pandemic at some point, hopefully not in our lifetimes, but at some point. And we know from these lessons that those are the areas that we really need to take a deep dive and make some systemic changes.
Patti, I'm going to point out the obvious right here. It is incredibly sad and must be so frustrating for you and for anybody who has a loved one in a long-term care facility that it took a pandemic to get to this point.
It is. And you know what? We're still reeling. You know, we're not through it yet. Right. We can see the light. We're still reeling from the impact of the deaths and not just live loss of our resident, but the impact on the families and our staff who are really still traumatized by what they've gone through. So we are hoping, we say, don't let any pandemic be lost to history without lessons learned. And we would be foolish to not really embrace these changes that we know will make a difference in the future.
We have had an incredible shortage of workers in this field specifically, which right. means they need to be paid better so that we can have more people wanting to get into this profession. This addresses the shortage. Do you think it does enough?
Well, no.
Okay.
I mean, we're going to be doing things like increasing wages, loan forgiveness, incentives to colleges to establish programs. But the one area where I hope we can move ahead is really the public portrayal of the direct care workforce as an honored profession. And so we know that there are people who need jobs, and we know we have jobs. And we have been working with DEED in our state and at the national level, Department of Labor, to try to match them up. But we also know that the workforce that we usually have other things that are barriers that have happened during this pandemic. They have young kids at home, virtual learning. They can't go to work on a dime. Working 24 hours a day, 7 days a week, including weekends and nights, is not attractive for a young mom with kids. So we have to figure out, there's a lot of possible solutions that we built in, but a lot of them are monetary. We need to make sure they can make a living wage.
Patti, let me take a quick break, and we're going to come back and we're going to talk about money, because that's what this is going to boil down to. It is going to take a lot of money and funding for this. And if I sound a little bit more bold or strong with this, it's because our seniors are getting shortchanged, and that saddens me. I'm continuing my conversation with Patti Cullen, who is the president and CEO of Care Providers Minnesota. We're talking about the Care for Our Seniors reforms that will be used for different pieces of legislation when it comes to nursing homes and long-term care facilities. Patti, this makes me sad, I said before the break, because the seniors in these long-term care facilities so often get forgotten, and so this is so important. But it's going to take a lot of money. What kind of funding are you looking at?
Well, it is significant, and the way we're talking about this is it's got to come from the federal level first, because we do have inequities between the different states' funding of long-term care programs. So we are first saying we need an enhanced federal match called FMAP, the Federal Medicaid Participation. Remember that a lot of people who are in our settings don't have means. Their Medicaid pays for them. So without an enhanced Medicaid match that the states can use to do some of the investments, we won't be able to fund any of this. So what we're looking for is enhanced federal match, flexibility with the funding that comes with this, and really making sure that states are held accountable. There are some states, ours isn't one of them, but there are some states we are very concerned that they'll get the money and run. In other words, they get the money without having an accountability that this is how they are using this additional federal funds. So that's a little bit in addition to what we've been talking about.
Don't they have state oversight kind of mandate groups that like yours that oversee a lot of these facilities and make sure that the money is spent where it's supposed to?
Well, yes and no, because it's easy when states have budget deficits to backfill holes. And
they dip into this kind of funding?
They would dip into any kind of enhanced federal match, because it's not viewed as this is money taken away from a senior. It's viewed as here's federal money coming to the state, and now the state has a budget hole, so we're going to use it.
But
so
the bottom line is it is coming out of seniors.
Correct.
Yeah.
Correct. That's not the headline you'll see, but that is actually why we want to hold accountability to this extra money that we're asking for to implement this.
Something in this Reforms Act is talking about making and improving the systems so that it's more resident driven. And I think we're kind of going in that direction with this conversation right now. But be specific on what that means.
So the best example I can give is that there are quality metrics that have been put out on what's a good facility, what's not a good facility, that are driven primarily by surveys, by inspections that come from the Department of Health, and not customer satisfaction surveys. In Minnesota, we have a state-based report card that has been invaluable for people to see what do other customers see. It's like when you and I go shopping, we look for the star. We're online. We don't want to buy something that has 1 star by it. We want to buy something that has 5 stars. And so similarly, we would love the Medicare program nationally to have a customer satisfaction base.
When we put a face on an issue, people tend to listen more. It tends to get more traction.
We need to get the word out there. And I continue to say that sometimes when you ignore seniors, it's kind of ageist.
Well, not only that, it's just plain wrong.
Right.
Yeah, Patti, I do appreciate you. Thank you.